get into this conversation now. The Tembisa Hospital continues to make headlines. It has now surfaced that the Gauteng Department of Health conducted a random audit at the hospital. This was back in August last year, and it flagged a lack of capacity among other issues. Now, this was before Babita Deokaran was assassinated after exposing a series of payment irregularities at that hospital. Let's get more now around this random audit, and we speak to the acting chief financial officer at the Gauteng Health Department, Masibolekwe Ndima. Mr. Ndima, thank you very much for your time. Firstly, why should the citizens or residents of Gauteng believe that this audit is indeed authentic? Because for all we know, some people, or should we say skeptics, will say this is perhaps one way to show or try and show that the suspended CFO tried to do something after Babita Deokaran alerted her to the problems at Tembisa.
Good morning, colleague, with your viewers. Unfortunately, I'm struggling with the camera. I think your question, you're saying that why should we think this audit is authentic? To answer your question and to be direct, as Gauteng, we do have a treasury department, and under it there is a Gauteng Audit Services. Now, they do this random audit based on their internal audit plan. And they did this audit as part of their plan, which is they do this quarterly internal audit, and they will raise issues. And if they raise issues, then they will then put some recommendation, which will go to management, and where management will need to find mitigating controls and correct those areas. But in terms of the authenticity of the audit, our Department of Treasury, with the Chief Audit Executive, they practice under the IIA internal audit standards. Okay. So the authenticity is there.
All right. So let's talk then about what prompted this internal audit at Tembisa Hospital. After what issues had come about?
As I said earlier, we have this planned audit in all of these institutions. And it was an audit that was on the plan to actually look into the SCM practices at Tembisa Hospital. And I think that it was on the plan in that particular quarter. And it had to be done, and it was done. And they flagged the issues of findings, which they gave recommendation, which is being mitigated by putting controls on them. Yes.
Okay. All right. And just so we are clear and that the viewer is not left wondering, this audit was not conducted as a result of the warnings that had been issued by Babita Deokaran.
No. Definitely. These audits are conducted randomly, and these audits are on the internal audit plan of the Gauteng Audit Services. Also, but I won't be much aware in terms of the enforcement and the time of the audit, as I'm acting. I'm only 7 days in the department, so I would not know what other enforcement by the CFO and management here. So, yes.
Let's discuss the key outcomes then. What did this audit find at that time?
What this audit find is that there was quite a number of issues that the audit find, and these issues were related to internal controls that are not being adhered to, and some weak controls, and also some non-compliance to prescript. Example, the institution did not have a demand management plan that they would use to procure not entirely, the quotation process was not followed entirely, issues around CSD and so forth, and others relate to non-compliance to the prescript and the PFMA. Thank you.
All right. So
those are yes.
Let's pick up on the quotation processes that you talk about, because much of what was flagged here by the person who is now deceased were the irregular payments. What steps were taken to make sure that those controls were tightened?
What happens, Koli, I think I'm also been brought here as part of actually ensuring that those controls are strengthened. So in a situation like this where we get an internal audit, management is perceived as the first line of defense. So the management will then design these controls and actually implement these controls. And but then in terms of a follow-up on this control, we'll need to give these controls some bit of a time frame. And one of the reasons that I'm here is to actually ensure that the stability and these controls are effective and they are followed. So it's an ongoing process. If maybe we had enough time, because the audit was only concluded on the 23rd of August. So if we had enough time, because according to the standard, you got to give management some time to implement these controls, ensuring that they are monitoring mechanism, which is some we've put, some we have already put, to ensure when the auditors are coming back after 6 or 12 months, then we'll leverage that of an assurance that the controls that we've put there are working and they operate as they are intended.
The person on whose behalf or in whose position you are acting, Lerato Madio, who is now on suspension, would you say without a doubt that she worked furiously to make sure that these controls were tightened?
I think that is a very good question, but it would be unfair for me to actually be at Ms. Madio's shoes currently. As I told you, this is my actually 8th day at the department, and I have not received any form of handover from her. So as a matter of principle, I would not try and characterize herself in a particular way. Thank you.
And the hospital CEO, were there any directives issued specifically for that person to tighten up controls?
Look, prior at the time, as I told you that I'm still looking at these matters. And remember, currently now, most of the information is been gathered and provided to the Special Investigation Unit. Also, it's quite a tight-up situation for me to comment on, because I was not there. But one thing that I know is that currently the department, we do actually have put some enforcement, have put some instruction, and I think in the next week or so I will be conducting road shows to ensure that these institutions do understand the meaning of this instruction and what is it that they need to do to ensure that we prevent a similar incident, or we cap these irregularities and anomalies that have been experienced by the Tembisa Hospital.
That's the acting CFO at the Gauteng Department of Health, Mr. Masibolekwe Ndima. Thank you very much for your time.